Good evening, everybody. I'd like to start this presentation by first congratulating everyone on your reunion. Thank you so much for inviting me to give this presentation, and I hope that it's enjoyable to you and you pick up a few things. I already feel like I'm a member of your class by association. But my name is Dr. Anireto Chika. I am a consultant family physician. I am also a BEC certified cognitive behavioral therapist. What that means is that I treat people that have psychological difficulties like depression, anxiety, and things like that. I'm also the MD of Sunshine Clinics in Abuja. I'll be talking to you about how to handle stress. I'll start by telling you what I hope to achieve by this presentation. I hope at the end of the day that you understand what stress is, what causes it, its consequences, and most importantly, how to handle it. I'll use this outline. I'll first explain what stress is, what causes it, its consequences, and what to do about it. So, what is stress? Stress is a perceived substantial imbalance between demand and response capability under conditions in which failure to meet these demands has important or perceived consequences. It's a perception. Generally, what this means is that stress is that feeling you have when you feel like what is expected of you, the demand from you, is more than your ability to give. It's beyond your capability. Under conditions, in that circumstance where you feel like this demand is more than what you can give, the consequences of not meeting that demand is perceived by you as catastrophic. So that generally is what stress is. It's a feeling, it's a perception. It's important to point out that stress is indeed a perception because two people might be in the same environment. One would be stressed and the other would not be. This definition is by a psychologist called McGrath, GEA. So stress can be either acute or chronic. It's something that can last for a few days or it can persist for months. The importance is that the chronic stress is really what we're worried about. It's really what this presentation is about because when stress is ongoing and relentless, the initial response or the idea of stress, the reason why this response exists in our body, that God, created us this way, is to prepare us for challenges, to be able to cope with that feeling like we are, what is placed upon us, what is demanded of us is more than we can handle. So stress, if it's acute, is actually helpful. However, if it is chronic, it becomes deleterious, becomes harmful. So what is the stress response? It is something mediated. This response is mediated by our brain and our hormones. There's a part of the brain called the amygdala. So what it does is when it's has this receives this stimulus, this fearful or sensation that we're under threat, it transfers an impulse to another part of the brain called the hypothalamus over here. The amygdala is here, hypothalamus is over here. And the hypothalamus releases a chemical called corticotrophin releasing hormone, which prompts the pituitary gland, another part of the brain over here, to release another hormone, which increases a hormone from the adrenal glands, which is on top of our kidney here. The bottom line is that a hormone called cortisol is released into our bloodstream. Cortisol is responsible for increasing our blood pressure, for helping us to target our blood to the areas that that are required in that time of need, like our muscles. So imagine when you have to study for an exam. So these chemicals are released in your bloodstream and you're able to focus better, you are able to understand better. All of a sudden, your mind is clear and you're able to prepare adequately for the exam. You're able to study at night and stay awake. However, if this goes on chronically, the same response that was helpful in preparing us for emergencies or stressful, difficult situation begins to wear away the very same body, begins to wear us down, and can result in things like increased blood pressure, increased blood sugar. So, what causes stress? Stress can be external from things like career, family, home, health, security, or it can be internal from things like the way we see ourselves, our perceptions, our beliefs, our ideas. Extrinsic factors are what I just explained, things from outside. The intrinsic factors are things from within, the way we were born, our personality, the way we see things. Unhelpful core beliefs. A core belief is the basic way we see ourselves. So if you see yourself as not good enough, not measuring up, just because you have that perception, things that would not necessarily be stress for other people tends to be stressful for you because of the way you see yourself. You have that outlook of, I need to work extra hard, I need to put in so much because of this idea that I don't measure up. There's something called external versus internal locus of control. Basically, internal locus of control is the belief that the things that happen to you are, in fact, within your control. Whereas external locus of control gives you a feeling of being helpless, that the things happening to you are beyond your control. And it increases that feeling of helplessness, feeling of being out of control, not within your control. Some other intrinsic factors include unhelpful coping strategies. The things we do to cope with stress can actually worsen the stress itself, like increased alcohol intake, substance use, unhelpful relationships. These things we do to help us handle stress can actually worsen it. Stress has physical symptoms. It is a perception, but because of what I explained about the neurological nature, the anatomical um, origin of the stress, it can actually give rise to physical symptoms like poor sleep, reduced appetite, diarrhea, aggravation of pre existing pain, and even pre existing conditions. So, when we're stressed, and perhaps you might have a pre existing condition like hypertension, stress worsens it, makes it more difficult for your blood pressure to be controlled and even your blood sugar. Stress also causes recurrent acute illnesses. So, what that means, how that happens, is that stress reduces your level of immunity, and then you are more susceptible to acute illnesses like common cold and malaria. Stress will affect how you think, increasing poor concentration, forgetfulness, making you less able to handle frustration and makes you irritable. Generally, stress has effect in the entire body. It affects both your body, not just your body, your mind, the way you think, affects what you do and affects your emotions. And how this happens is because remember, stress is a perception that what is before me is bigger than I can handle. So it makes me see myself, if I'm stressed, a certain way. And the things I say to myself, my thoughts, are the things that give rise to my emotions, and my emotions are the things that give rise to my behavior. Consequences. So, chronic stress, if unmitigated, not ameliorated, has consequences both to the individual at his or her place of work and in his or her family. So, to the individual, it actually does increase susceptibility to minor illnesses, like I mentioned, and even to some cancers like lung cancer and colorectal cancer. Chronic stress, not handled, can also increase the risk of heart disease and stroke and obesity. So, note that I said increases the risk of, it's not directly responsible for it, but psychosocial problems are indeed a minor risk factor for problems like heart disease, stroke, and obesity. Stress because of person's ability or lack of it to concentrate and focus can also increase the risk of injury and mistakes. So imagine being an admin staff or in an audit firm or a medical staff and you're stressed, chronic stress, increased risk of errors. Other consequences are within the family. So, if you don't know or learn how to handle stress properly, there's a tendency that you might withdraw yourself from family members, and then there's this disconnection from your spouse and from your children. Or if you tend to use negative or unhelpful coping strategies like unhelpful relationships, like infidelity, so that further complicates issues and causes a problem in the family. It can also lead to neglect of the child, infidelity, and children typically can actually act out. In other words, convert into behavior some of the difficulties they're having as a result of stress from their parents. Work related consequences, it can actually increase the risk of sick offs and absenteeism and also affect productivity. So, how do we deal with this? What can we do to handle stress? So many things. But the first thing is to identify that stress is present. to identify that the source of it, whether it's within you, whether it's outside, or whether it's both. To be able to achieve this, you'd have to be someone who is self-aware. And to be self-aware means, you to be able to become self-aware, you have to spend time by yourself. I call it me time, and this is what I advocate to people all the time. At least 30 minutes of self-reflection. And what would that look like? It would look like you being on your own, really being aware of what you're feeling, observe and notice the feelings and the thoughts that go through your mind, the emotions you have, just as if you're an observer, as if you're a reporter, just noticing it without, trying to criticize or blame yourself. So trying to do that every day increases your level of self-awareness and helps you to be able to pinpoint exactly where the stress is coming from if you are actually stressed. Another thing that helps tremendously is forgiveness. So, we've been talking so much about what stress is, how it affects us, how it even affects our families, our relationships, our physical health. So, practicing forgiveness is actually you doing yourself a favor. It's you cutting the chain of whatever grudge, whatever you hold against anyone else, and freeing yourself to live your best life. So the first thing to do to handle stress is to identify that it is present, to identify what kind of stress you're going, where it's coming from rather. The second thing is to ask yourself, is this stress within my control or influence? In other words, is there anything I can do to reduce the stress? Or is there someone I know? Is it under my influence? If yes, then you can use a type of coping strategy called problem focused coping strategy to handle the stress. If no, then you would use emotion focused coping strategy. And this kind of coping strategy is also helpful to change your own perception, especially when you have negative beliefs about yourself, about other people, about the world, and that in itself is responsible for the stress that you feel. There's several types of emotion focused coping. Some of them are helpful, which I'm about to explain. Others are not so helpful. Helpful ways to cope. Regular self care. Basically, I'm saying prioritize yourself. So, in this world where we're multitasking, doing so many things, trying to achieve our personal goals, trying to climb up the corporate ladder, trying to look out for the kids, the wife, the husband, the relation, so many things can crowd your plate, if I might say. So it's important to put yourself first. Now, I don't mean that from a selfish point of view. I mean that from a helpful point of view, because if you don't prioritize yourself and put yourself first, you may not be able to help other people and even be effective in your place of work. Just remember, when you're about to take a flight and they say if there's an emergency, some mask will fall down from the panel above your head, fit your own mask first before helping others. Because if you don't wear your oxygen mask, then you wouldn't be conscious enough to help anybody else. So regular self-care means put yourself first. Take care of your physical needs, take care of your emotional needs, talk to yourself with self-compassion, ask yourself what you need and give yourself what you need. Self-awareness. Self-awareness is what I spoke earlier of, which is take time to really get to know yourself. Take time to assess what's going on in your internal, reality and ask yourself, what am I thinking? What am I feeling? What's going on? Where's the stress coming from? And this is to be preferred to avoidance, which is where you notice that perhaps there's something annoying you, but rather than deal with it head on, you avoid it and just distract yourself. Just keep distracting yourself. Video games, playing out, hanging out with the girls, hanging out with the boys, and then you don't ever deal with what the real problem is. The problem with that is the more you avoid, it may look like you're running away from it, but it actually does catch up with you and shows up in different ways, like your ability to handle frustration, like your ability to tolerate negative events, and then you find yourself irritable and you find yourself easily upset, and you might not even know why. Express yourself is another way to deal with stress. This is stress that is beyond your control. And you can do that by disclosure, meaning you have someone you trust, you have someone you're confident in, you tell them what's going on. Or if you don't have anyone you feel so confident in, you can journal, Some people prefer to express themselves by singing, by painting, by drawing. It's all about expression, whichever feels more comfortable. Another way to cope with things beyond your control is spirituality, huge. Prayer, meditation, declaration, saying to yourself what the Holy Book says is huge in terms of helping you deal with things you cannot change. Deep breathing helps tremendously, and there's a technique that is backed by science called the 4-7-8 technique. So, what it means is you take a deep breath while counting to 4 in your mind, you hold your breath while counting to 7 in your mind, and then you exhale while counting to 8. So, inhale for 4, hold your breath for 7, exhale for 8. So, what this does is it automatically induces the stress, the relaxation response. So, it makes you relax. And this is excellent for short periods of stress when you have, for instance, to give a presentation or you have to, you know, do something accurately, write an exam, and you need to really be relaxed. Then you can breathe in for 4, hold it for 7, and exhale for 8, and that would really reduce your stress and induce relaxation. Another helpful technique to cope with things you cannot change is visualization. So, what that means is imagining in your mind's eye yourself coping or dealing with this situation. It might be something as simple as, going to meet the in-laws, or, going to have a difficult conversation with your spouse or with your colleague or with your boss. So visualization is you imagining the outcome, in your favor before you even leave. So what happens is that it makes you relax and makes it more likely that you have the outcome that you visualize. Imaginary rehearsal is where you are scheduled to do something, you imagine the things that could go wrong, and then you rehearse how to address these issues that could go wrong in your imagination. So, doing that in the imagination makes you feel like you've already started practicing it, so that when you are in that situation, you are more confident and more likely to actually cope in that situation. Mindfulness is, a whole new ball game altogether by itself, but I'll just describe it by saying it means live in the present. There is so much pressure on every one of us to live in the past, ruminating about things that have happened, what we didn't do right, blaming ourselves, criticizing ourselves, or living the future, what might happen, what might go wrong, and worrying, and then our lives just pass us by. And this removes some of the pleasure we could derive from the very moment, from smelling the roses, as it were. So, one way to deal with stress is to leave it, especially if you can do nothing about it, leave it in the past. It's something that has passed already, and just focus your mind on being present. Or don't worry about the future, especially if there's nothing you can do about it. Live in the present. Distraction is a way to cope, but the caveat here is it is temporary, because if you keep distracting yourself, it becomes a way of avoiding what is in front of you, even if you can't do anything about it. And what happens is that it shows up in different areas of your life and actually affects. Assertiveness is one way to help yourself deal with stress. Instead of being passive or aggressive in your communication, you're talking to people, your colleagues, your significant other. Assertiveness is where you stand up for yourself, and at the same time, you are respecting the other person's personal space. You're respecting the other person's rights, as it were. Being aggressive is where you are, pushing your own agenda, pushing your own rights, and actually infringing on the rights of the other person. Being passive is when you let the other person infringe on your own rights, and then you're not saying and, fully expressing yourself as you want to. So being assertive is the middle lane where you stand up for yourself and as well respect the rights of the person that you're talking to. On hopeful coping strategies, I felt it was important to mention this because we indirectly engage in some of these coping strategies without really knowing that they are not doing us any good. Using substances, sleeping pills, alcohol, recreational drugs. The lure they have is that they really do actually induce relaxation immediately. They really do take our minds off of the problem immediately. But the downside is that they have way more disadvantages than they ever have advantages, like they would reduce our ability to cope, they would blur our judgment, talking about alcohol, increase the risk of maybe accidents, making mistakes, losing your job, losing your relationships. Eating more is another unhelpful coping strategy. Some people cope by eating. Eating comforts them. But the problem with this is that you might gain weight, increase the risk of diabetes, hypertension, eating disorders. At the end of the day, the succor or the relief these types of coping methods give is very temporary, and the disadvantages way outweigh the advantages. Infidelity, avoidance, rumination is thinking about something that has gone wrong and going over and over it in your mind. Catastrophizing is thinking the worst. So there's a stressful situation, you can't do anything about it. Then rather than maybe pray or disclose or express, you catastrophize, you think the worst. What happens is that your anxiety increases and you have maybe heart palpitations, you might have a headache because you can't sleep, and you just make things worse. Non disclosure, where we feel like some people feel like talking about things I can't change means I'm weak or it shows that I'm inept, incompetent. That is not the case. Disclosure actually helps you feel better. Perception. When I was explaining about the causes of stress, I mentioned intrinsic causes, and I said one of them is how you see things. So if you notice a change in your mood, you can ask yourself, what am I thinking? What's going on in my mind? And that thought, the statement that comes into your mind, these are called automatic thoughts. This is like your self talk. So, every one of us, as we live our lives, you are running commentary, either criticizing ourselves, blaming ourselves, or encouraging ourselves. This is important because the things we say to ourselves affect how we feel. And how we feel affects how we behave. And how we behave is huge because we behave certain ways in our place of work, we behave a certain way in our families, and these all affect other people. So, whatever you're thinking, whenever you notice your mood change and you ask yourself, what are you thinking? What's going on in my mind? Those statements, the automatic thoughts, your self talk, ask yourself, ask these questions of the self talk. What's the evidence that this thing I'm thinking is true? What's the evidence that it's not true? Is there another way to look at it? So what if it's true? So an example would be my boss hates me. He's out for me. And that is my self talk, asking myself, what is the evidence that said this is true? Well, evidence in favor could be that I was declined a promotion. What is the evidence against? Okay, I didn't really prepare for that promotion examination. Is there an alternative way to look at it? My boss is just doing his job the way I'm doing my job, and I probably should read harder for the next promotion exam. So, this is one way to reduce your stress by not taking the thoughts you have and believing them hook, line, and sinker. There's a saying in psychotherapy that just because you think something does not necessarily mean it's true. So, instead of taking every thought that comes to your mind hook, line, and sinker, question it. Use the FAST technique. Ask yourself, what is the evidence in favor and against? Is there an alternative way to look at it? So, what if it's true? What's the worst that could happen? And then, what's the best that could happen? What are the advantages or disadvantages of thinking this way, talking about the problem oriented coping? So, if it is something you can handle, if it is something you can do something about, if the source of the stress is something within your control, then you'd go into problem solving. What is the problem? What are the options? What can I do about this problem? What are the advantages and disadvantages of these various options? And then you pick the option that has the highest advantage and the least advantage. Another way to handle, problems that are within your control is to manage your time. Sometimes our problem or our source of stress is really that we lose ourselves in some activity and we lose track of time. And then we have to rush or we procrastinate and then we are rushed and then we do a shoddy job and then, it goes downhill from there. So sometimes something like time management could actually be your way of reducing stress. Sometimes it could also mean obtaining instrumental support, like get professional help. If you have physical problems and you're wondering what's going on, rather than going to Google, you might want to talk to a physician. If you have, problems at home because you have so much on your plate, for instance, you're a busy executive, then maybe the problem would be get support. Other ways to handle stress is to be sure that you maintain a healthy work-life balance. This is especially key for work-related stress. Maintain a healthy lifestyle and pay attention to how you communicate. So, more detail about that. How do we maintain a work-life balance? It's by exploring and enriching the other things you value, the other things you're passionate about. A lot of us live our lives, the only thing that matters to us is just our job. The only aspect of our life is our job. So if we lose our job, we don't see ourselves any other way. Our very self-concept comes is derived from our job. So this is, one way to increase your risk of being stressed, because that means if the work is stressful, then your whole life is stressful. But rather than doing that, combat that by compartmentalization. What that means is develop other areas in your life that you're passionate about, that you care about. And it could be in different areas, like in spirituality. Is spirituality something that's important to you? What goals do you have for yourself in that area? And how could you actualize those goals? What if it's in family? You love your family, family is a value, it's something you're passionate about. What goals do you have for that aspect of your life? Perhaps you want a close family. All right. So what behaviors can you engage in that would make it more likely that your family is close? Perhaps you can go out every so often. Perhaps you can schedule, some time alone with the wife, with the husband, or some time alone with the kids. So exploring other things that matter to you, prioritizing your life apart from work, and enriching those other aspects of your life would really help you to achieve that balance, so that your life is more than just your job. Achieving a healthy lifestyle is one huge way to ensure that you handle stress properly. Why? Because we're more than just um, emotions and work and body. We're everything combined. So if you take care of your body, you are also actually reducing your vulnerability to stress and difficult emotions. So how do you do that? Exercise. So if you're of the appropriate weight, your body mass index is within 18 to 24.9, then you need to be exercising for about 30 minutes a day. That means you're not trying to lose weight. If you're overweight, your body mass index, that is your weight for your height. If you measure your height, you measure your weight, you if your weight is in kilograms, so you divide your weight by the square of your height, and the number you get is less than, or if it's above 25, then you're overweight, then you need to lose some weight, and then you need to exercise about an hour. So whichever be the case, you're balancing and you're, mixing aerobic exercise, the running, some weightlifting, some flexibility exercises like stretching, and you're trying to do that regularly, like 4 to 5 times as a target a week. But my advice always is to start gradually. So if you can manage 2 times a week, perfect. Sustain that and then increase that gradually. Diet is huge because we are, after all, what we eat. So a plate, imagine this to be your plate and divide it into two. So on one side, the whole half of the plate is vegetables and fruit. The other half divided into two. Then one quarter is um, carbohydrates, be it complex, be it simple. Complex preferable, meaning brown rice or fada rice, brown bread, complex carbohydrates like beans, like oats, like quinoa, like lentils, and then the remaining quarter of that second half is protein, preferably white meat like fish and chicken. It doesn't mean you can't eat red meat, but just make that sparingly once or twice a week. Adequate sleep is huge. Not having proper sleep makes everything else worse. If you're not sleeping well, the problem at work seems to be magnified, and even your ability to deal with it is somehow compromised. So do your best to get enough sleep. So how many hours is enough? Actually, that depends on how old you are, your own personality, how much sleep we all need differs. But on average, you should get more than 6 hours of sleep every night. Water intake is huge because our body is, composed largely of water and avoid substances. Deep breathing, like I mentioned before, the 4-7-8 actually does induce the relaxation response. Visualizing yourself coping could actually be like a temporary escape, like having a mini vacation in your mind, going to that place that is safe for you. Imagining yourself in a safe place is another way to really reduce your stress. Communication. People sometimes aggravate the stress they feel because they're not able to express themselves correctly. So, using this idea acronym IDEA helps you to remember how to actually, say your mind without hurting or infringing on the rights of somebody else. So, the I is the icebreaker. The D is to describe a situation. The icebreaker means you state the emotion you see. I can see you're angry, and given how I spoke to you, I understand, and if you need to apologize, apologize. But you forgot to book my flight. That's the situation. You express how you feel, starting with I. I felt forgotten. I felt like you didn't care about me, rather than you are incompetent and you are stupid. And then assert, say what you want. I would love it if you have difficulties next time to let me know so I can plan. So, in conclusion, stress is actually universal. Everyone is stressed, including children. It could be acute or chronic. Chronic stress is actually detrimental to not only our mental health, but physical health as well. I hope that using the techniques and the strategies we just discussed would really help you to deal with work related stress and other types of stress and increase your physical and emotional well being. Thank you.